According to Combs, the diagnosis and treatment of psychosexual disorder traditionally focused on problems caused by decreases in sexual desire or abnormalities in the person's sexual desire. However, there's increasing public attention and professional perplexity about sexual problems resulting from uncontrolled or excessive sexual behaviors, hypersexuality. These behaviors are not inherently abnormal and have been addressed punitively rather than clinically, leading to the behavior often continuing. Excessive sexual urges and behaviors are often best viewed as behavioral addictions. The term sexual addiction is derived from the Diagnosis and Statistical Manual of Mental Disorder Diagnosis Criteria for Substance Dependency. If the term sexual fantasy, sexual urge, or sexual behavior is substituted for substance use, the same diagnostic criteria can be applied to addictive sexual disorders. Any behavior can be viewed as an addiction if it is characterized by loss of control, continuation despite significant adverse consequences, an obsession or preoccupation. According to Combs, the crucial issue is that the frequency of sexual behavior, but the consequences of the behavior on the person's health, relationship, career, or legal status. An addictive disorder eventually creates unmanageable in the person's life. Even though the person is not taking some form of a drug, sex addiction has the same chemical response in the person's body, like the release of dopamine. Sexual addiction is common in the American population, with an estimated prevalence of 6%. However, there is no information on the prevalence in other cultures, as the definition depends on consequences. A study of sexual compulsivity in 294 HIV-positive men and women found that 16.6 scored high on a standardized measure threshold, more significant than the general population. Additionally, 33% of the sexual compulsive group had used cocaine in the previous 3 months compared to 10% of the non-compulsive group. Combs suggests that the sexual compulsivity may be potent risk factor for HIV transmission and that traditional HIV risk reduction interventions may be ineffective for this group who needed treatment for their sexual complicity. The DSM-5 categorizes specific sexual behaviors as psychosexual disorders, including voyeurism, exhibition, and fetishism, the act of touching others for sexual gratification without consent, while deeming other behaviors such as engaging in sexual relationships with multiple partners or masturbation as psychological normal. Nevertheless, individuals may engage in typical sexual activities in both healthy and unhealthy manners. A sexual behavior is deemed healthy if the individual responds affirmatively to the following questions. Like, does this behavior agree with the person's values? Is it safe? Is it respectful of yourself or others? Is it honest? Is it spontaneous and playful? Does it increase intimacy? Are both partners free to choose? Thanks.